Hi, my name is Jenn Wyld and I am a Patient Activity Coordinator and registered nurse working within adult inpatient mental health services at Levendale Hospital. My job is to facilitate and coordinate a wide range of therapeutic activities for patients who are in an acute phase of their illness.
Hi, my name's also Jen. I had a short admission in one of the wards that Jen works in, and as part of that I had to isolate for 5 days as part of the pandemic protocol. Those 5 days felt like forever. I remember coming into the pack room after my isolation period ended and was so happy to see a friendly face.
This is when I had a What Matters to You conversation with Jen about what her experience was like and how this impacted on her initial settling in period on the ward. By providing Jen with a meaningful activity and space to explore her experiences, she was able to express her feelings and illustrate her experience to me.
I remember during the isolation period feeling really lonely and cut off from the ward environment, although the nurses did check in periodically, and I had a lot of time to think about the impact that this was having on all of the patients. I was given a really helpful information booklet which was very detailed, but I struggled to find the key information that I needed due to my lack of concentration. I also knew that this information was changing regularly throughout the pandemic. Over the weekend, I consulted other patients, spoke to the senior charge nurse and wrote a draft of a handout.
During the conversation, Jen highlighted a small amount of information that would be beneficial in a short handout in large print for the initial isolation period. Things like the Wi-Fi password, arrangements for people to come and visit or drop off belongings, and what happens at mealtimes. All the patients in the group agreed with Jen about the positive impact that this could have. This What Matters to You conversation inspired the ward to move towards creating a leaflet that would be made available to all patients on arrival to the hospital. I think that having this conversation has shown the importance of listening and by working together can improve the patient's journey.
I'm really pleased with what came out of the conversation we had, and I feel that I was really heard.